So the Ottawa Charter for Health Promotion came up with this model and this idea, and it talks about many things, and this is the idea of population health and looking at the way that the population receives health. And I'm not going to spend a long time going through this model because you will definitely look at this model when you study your community health, right? I think you studied it in community health, right? Yeah? So, but I'm going to just point out the key points about it because it does look at population health and health promotion in a different way. So it talks about the importance of building healthy public policy at a government level. This means things that are like laws and standards that must be followed by the governmental level and that are enforced by the government. So if we think about building healthy public policy, that would be include things like the fact that we have Sports Day in Qatar. So there is a problem with obesity in Qatar. There's a problem with people not being as active. So the Emir, 5 years ago, said we want to stop this as a problem. We need to encourage people to be more healthy. So they developed a policy to encourage more health. More funding was given to sporting activities, right? Aspire had more money and more activities throughout the country to support sporting activities, encourage people to do sports. And the national holiday of Sports Day was created to encourage people to live a healthier lifestyle and spend time with their families doing physical activity. So this is an example of a policy, right? A policy towards moving towards physical fitness. And so a national holiday was created for that purpose. So in order for this idea to kind of get there and make these laws, first there has to be like awareness and understanding that there are problems with our health. And so it really starts at the individual level. And the model is kind of fluid, so you can kind of start anywhere. But we can talk about developing personal skills. So this would be like your first you inside you wanting to improve your health. So if we use the idea of smoking cessation, okay, as an idea of something that could be changed or would want to be changed by an individual. So if I am going to quit smoking, I want to develop my personal skills. So I want to develop my own understanding about why smoking is bad, how I can quit smoking, what kind of things I might do to help me quit smoking. So maybe I need to use a nicotine patch, or maybe I need support from my friends, maybe I need counseling. Maybe I need to have information about the fact that smoking is an appetite suppressant, so when I quit smoking, I'm probably going to gain weight, right? So all of this would come in my own knowledge and ability, right? My own personal skills that I would start to develop about my healthcare challenge within myself. But there are things that help us to have this knowledge and understanding. And part of this comes from the healthcare provider who really enables people or supports them to make wise decisions. They help mediate challenges, meaning if there's a problem, maybe I don't have access to nicotine patches, I need a prescription. So a healthcare provider can help you access somebody who can write you a prescription. They can help you with funding for some project or something like that, somebody who helps you solve the problems as an individual. And healthcare providers can act as an advocate. So we can advocate that changes can happen in society. Healthcare providers also play a role in creating supportive environments. So we want to create environments that people feel safe to make healthcare decisions and safe to make healthcare changes. We want to ensure that our schools and our places of employment and our whole societal environment are really positive, that allow people to make changes, that there's not a lot of other barriers that prevent them from doing that. And we also can physically act as support people for our patients, right? Maybe they come regularly to your clinic for follow-up, right? So we can be one of those support people that encourage change. And by doing these things and focusing our health services on improving health and before people get sick, giving them treatment before they get sick, so changing our perspective, instead of pumping our healthcare dollars into cardiac care post-MI or better equipment for surgeries or lap banding and gastric banding. Instead of thinking about these like after people are sick, after people have problem, and pumping our healthcare dollars into there, instead reorienting our health services to primary prevention, meaning that we teach children about healthy lifestyle. We provide educational strategies about nutrition, about not smoking, about living a healthy lifestyle, about the importance of exercise, about what to do when there's a dust storm. All of these things, right? This health teaching before people get sick. We want to teach people before they get sick because actually it's cheaper, right, for healthcare dollars, and it keeps our population healthier. So this is an idea of reorienting health services. The Canadian government would have had to spend millions and millions of dollars educating school children, educating society about the importance of seatbelt safety. But what they've done is save themselves millions and millions of dollars in emergency healthcare costs for people being admitted through ambulance services for motor vehicle collisions, right? So this is the idea of primary prevention. So doing all of these things together really strengthen our communities and allow us to build healthy public policy or change governmental laws about health and overall improve the health of our population. So this is the idea of health promotion. I think it's a good idea, and I think it's very positive for societal health.